Well, I started North Shore Health probably about 25 years ago, and I started off as a dishwasher in the kitchen, and then I did the nursing assistant training, became a nursing assistant. I did the LPN training, became an LPN, did the RN training, became an RN, and ended up director of nursing for the care center. And I managed to do it all the time while I was in Grand Marais working here. So it's nice to be able to advance your career while still being in Grand Marais.
I actually started as a nursing assistant in '94 when I started here, and then the lab needed people, so I went back to school for medical lab tech. And actually the hospital board helped me pay for that because they were in need at that time for it. And I have since worked in here for 10 years since I got my degree as a medical lab tech.
I started working here first as an EMT, and then within a week or two of starting as an EMT, I got my nursing aid certification. So I was doing both roles here at the hospital, working on the ambulance part-time and then working here at the care center part-time.
There's so many opportunities up here, whether it be from housekeeping to nursing. There's a place for everybody here somewhere.
I started out in billing and have moved all the way through up on into accounting, and that has been through the support of the people around me and my supervisors, with the belief that I have the ability to do something so much more.
The most rewarding things that I find at North Shore Health have to be the peer-to-peer relationships, working with the patients and the community as a whole, and that it's a very kind, supportive community that I'm able to advance myself as a clinician, but also as a person.
There's much more of a community impact working here than I might find at a larger hospital like in the Duluth area or the Twin Cities area, where I more than likely wouldn't know anybody coming in during the day.
It's a good feeling. It's worth a lot to feel that you've done something really good for people and you've made a difference.
The things I find most rewarding working here are not only the people who I work with and together, but I feel that we do so much for our community. Not only the people who live here, but also our visitors.
Yeah, it's really nice when you drop somebody off in Duluth after a long transfer and they say like thank you, and you say, I hope you feel better soon, and sometimes you see them around town later.
At the end of the day, we're helping people that we live around. We're helping the families that are friends of our families.
Of the joy on people's face when we can be a lightness in a bad day for them.
I love helping people. I love the ability to see them progress every single day, every single week, and get them back to the things that they love.
We do have people that will see us even years later and thank us for what we did, so it does mean a lot to us.
So I've done my nursing assistant training here, my LPN training here, my RN training from here. I mean, fortunately, Cook County Higher Education is a really good place to start. And these days they have a lot more long-distance learning over the internet.
I've done all of my education for healthcare through the county, and for the most part it's all been funded either by the hospital or through scholarships locally. So I got my EMT license, I got my nursing assistant certification, I got my Associates of Nursing through Lake Superior College.
I have a lot of really good coworkers over the years.
I think I see my coworkers outside of work at least once or twice every single week, whether it's going out on a bike ride, fishing, playing tennis, or just catching up and having a good time.
We do a lot of things outside of here as friends also.
I have made friendships that will last forever, and I have connected with people outside in the healthcare community statewide who have led me to find my passion in what I do daily.
Yeah, I definitely developed strong relationships with my coworkers. A lot of us have similar likes and dislikes, and there's a lot of time to chat when we're not out on calls or making transfers.
The number of times that I have been amazed by how the upper administration comes in and tries to help us out when we're we're really struggling or busy or just need something is pretty incredible. There's many times that Kimber, our administrator, is in the ER helping us, with phone calls or helping us, manage a patient who's, having a behavioral health crisis or something like that. And that doesn't happen anywhere else.
I have great relationships with my patients. This being a small community, I get to see them in day-to-day activities, and there's nothing better than when I'm out driving through town and I see that individual walking with their grandchild or doing the things that they love and having no limitations.
I'm very social, and I like to have that involvement with my patients, and being able to see them in a small community, be able to see them outside of work also is very nice.
Grand Marais is a great place to live and work.
It's an awesome place to raise a family. I think that all of the community gets along very well. It's a very welcoming community.
I love this community because the people are there for each other.
I like the community. I like the closeness. I like the outdoors too, though, and being able to fresh air. And just to raise a family, like I said, it's close. People are all friends basically up here. You can go in the grocery store and talk to just about everybody, and everybody looks out for everybody else.
Just a beautiful place. It's clean, it's natural, it's a sense of community.
It's a safe community. We are a very diverse community. We have athletics, we have artistry, we have outdoor activities beyond your wildest dreams.
We lived here for probably 3 years before I realized that the key to my front door didn't work. So, it's a very safe community. The schools are good. We've got a lot of, it's a town of 1,300 people, but, we've got a library, we've got 3 grocery stores, we've got lots of restaurants. There's the art colony, there's North House Folk School, higher ed. There's just all these resources here that are just so unusual for a town of 1,300 people.
I am fortunate and blessed to live here in town, 2.5 blocks away from Lake Superior. When you stand on my front porch, I look between the 2 lighthouses, so I don't think it can get any better than that.
I like to go out and hike and fish and ski, and so whether it's the local outdoor hockey rink or the local stream, I just love being outside.
I like to do camping. We like to just have bonfires and everybody gather and just hang out in the backyard. I do some hiking. There's some interesting trails and history up here too.
Well, I'm a pretty avid outdoorsy person. I'm a regular runner. I cross-country ski. We like to camp and fish and canoe.
In the summer, I like paddleboarding or swimming up at the lakes. I'm a big runner. I did a lot of running in high school and middle school. And just kind of spending time hiking on all the trails. You can always find a new one, so it's always fun, a little adventure.
The ability to just walk into the woods and see moose and wolves and foxes, and just the sheer amount of wildlife, and to be able to have my kids experience that.
I really love canoeing and fishing in the summer. In the winter, I really like knitting, so I like to sit inside and knit and read books, but mostly anything that involves getting outside.
If you're looking for a sign to get up and follow your passions to a place that you love and can adventure, and then also continue to provide the great care that you do elsewhere, this is your sign.
Anybody who's at all interested should definitely give it a try.